Welcome back to Healthcare for Teens, a channel dedicated to helping teenagers understand more about the different areas of healthcare. Today we have with us Mr. Jonathan Szeto, a student at the University of Pennsylvania's Perelman School of Medicine. Jonathan, thank you so much for being here with us today.
Thank you for having me.
I'd like to begin this interview by asking you, as a first-year medical student at UPenn, what have you learned about the challenges of medical school?
Yeah, I think like the biggest challenge that us first years have are really academic in nature. Everything that people say about drinking out of the fire hose in terms of medical school is true. You really do learn a lot of material in a very short period of time. And in fact, I think that I probably have learned more clinically relevant basic science in the past 4 months than I have throughout like all 4 years of my college experience. And so I think it is a big challenge academically to transition to such a fast-paced learning environment, especially for people who might have like come from like gap years where they hadn't studied for a while, or from senior year of college where a lot of us, quite frankly, had like senioritis. And so that academic transition is very challenging for us first years. And then I think another big challenge for first years is also really just learning how to balance your schedule and how to prioritize certain activities. In a lot of ways, med school is more like high school than college because um, you don't have as much control of your academic schedule. And so a lot of us we all actually at first year have classes until like 2 o'clock. And then after that, we have like our extracurricular time where we can decide if we want to do like research or do like more like fun clubs for our well-being or devote more time to clinic. And I think as medical students, we kind of want to do it all, but it's very important for us to learn how to balance and say no to certain things that might not benefit us personally or professionally. And I think just learning where to draw that line for our own sake so that we don't go burned out is something that is new to many of us and something a lot of us have to get used to.
In a Penn Medicine news article, you were featured for being involved in the Penn Medicine summer program. How has this program influenced your career so far, and what have you learned from it?
Yeah, I mean, I'm not gonna lie. I did that program like 6 years ago. And so the substantive and the technical aspects that I learned over those like 5 weeks of summer camp, I don't remember too much about it. Like the lectures we did, I won't lie, I won't don't remember like a lot of the details from that. But I think what made the program very influential in my journey to medicine, and I think what made it very influential for a lot of the other campers that I'm still friends with and have also decided to go into medicine, is that it really gave us an early exposure to the field that not everyone really gets access to. And I think there's just such an advantage of having that early exposure because you either knew after that camp that you wanted to keep doing this, and then we got advice from a lot of like the teaching assistants or the professors that ran the camp about what we should do in college in order to prepare ourselves for medical school. And so we already got a leg up going in on how we can like best um, set ourselves up for success. And I think that is just like a huge advantage. And I think another big advantage is because I went into college knowing that I wanted to do medicine, I didn't have to spend as much time exploring medicine and spend as much time like shadowing. And I could spend a lot more time exploring other fields that are tangentially related, but not be directly related. So I spent a lot of time doing like environmental health and like political work. And I don't think I would have been able to do that if I hadn't done the summer camp and really like knew going into college that I wanted to do medicine. So yeah, I think just getting an early exposure is just very beneficial to me.
What areas of research are you involved in?
Yeah, right now, I'm involved in a couple of projects, and I think they kind of fall under two buckets. So, like, one bucket is more related to like environmental health. As I mentioned, I really care about the physical environment and how it affects human well-being. And so that research is more focused on looking how like environmental hazards, like extreme heat and like air pollution affect people's well-being, how it might exacerbate like pulmonary or cardiology cardiological diseases, and just thinking about what policies we can implement in order to make people healthier outside the hospital. And then the other bucket is more traditional clinical research, doing like chart reviews to look at like things that we do in the hospital and what can we do to improve our practices to better patient outcomes. So right now I'm working on a couple like projects with a few cardiothoracic surgeons and their residents to look at how can we improve the way that we do heart surgery in order to better outcomes for patients.
What goes into conducting research and why is it so significant?
Um, I mean, I'm not a PhD student, I'm not a seasoned researcher, so I'm not going to act like I'm some like research guru, but ultimately, in my opinion, research is all about helping people make more informed decisions. And so a big part about conducting research is staying up to date with the literature and up to date with like existing studies and past studies to see like what questions have been answered. And then once you know like what questions have been answered, then you can kind of start thinking about what questions need to be answered or what data or information is like outdated, so we should like update. And so then the next part about conducting research is thinking about what questions can be answered that would have a significant impact. And then I think that's like the third big part about conducting research is once you design your study, thinking about how this will like directly impact people and its like significance either clinically or I guess if you do like more social research socially. And ultimately, as I mentioned earlier, I think this is very important because the ultimate goal of research is to help improve, at least the research that I like to do is to improve like well-being. So it's very important to do like research in like environmental health and like social vulnerability because you want to know how to like we want to help like policymakers or like decision makers make better policies that help, I don't know, fix like the physical like barriers or systemic problems that like lead to like a lot of health disparities. And then going back to clinical research, as I mentioned, it's very important to do clinical research so that we make sure that our medical practices lead to the best patient outcomes and lead to our patients' best well-being.
What advice do you have for those applying to med school?
Um, I think like I can give some very generic advice. I think a lot of the advice people have on the internet is very true. Like take your grades very seriously. It's very important to have a good GPA and a good MCAT because fundamentally those are the most important parts of your application. And then also not being afraid to reach out and get mentors who can really guide you on the journey. Um, but I think like on a deeper level, a big piece of advice I like giving to a lot of people who are kind of like just starting thinking about applying to med school or if they want to commit to this journey is to like think about when you're applying to med school, don't apply to med school because you want to like be a doctor. I would say like apply to med school because there's like some problem or issue in the world that you want to solve and you can either only solve it in some angle that you want to solve it by being a doctor, or the impact that you have would be significantly greater if you were a doctor. Because ultimately, this is a very long time commitment. Like, I still have like 6 to 9 years of training left, depending on what I want to do. And I think that if your motivation is just, I want to go to med school to be a doctor or a surgeon, then you're more susceptible to like burnout and being miserable. Whereas I feel like if you have more of a mission driven mindset of perspective, then you'll be more motivated and you'll probably resist burnout and ultimately you'll be more fulfilled and have a better time during this whole process.
That's it for this video. And Mr. Jonathan Zito, thank you so much for being here with us today.
Mhm. Thank you for having me.